despite all the talk of veneers, tooth implants, and bright white Hollywood smiles, according to a new study, it turns out many Americans still prefer to keep their natural teeth. To discuss the benefits, we welcome President of the American Association of Endodontists, Dr. W. Craig Noblett. Dr. Noblett, thank you so much for doing this today.
Well, thank you for having me.
Well, let's talk about this. Why are you finding so many people feel so strongly about keeping those natural teeth?
Well, I think the public awareness of the benefits of keeping your natural teeth is on the upswing. They're critical to your function as far as chewing, speaking, and your natural smile is part of your self-image and your personality. And I think more and more people are realizing that that's why you want to keep your natural teeth. And that's what endodontists do. We're the specialist at helping you keep your natural teeth.
Which is amazing, because I think a lot of times when we think endodontist, we put that together with a root canal. But
well, that's all we do.
Exactly. And you know what? I think I've been through a few. They're not as bad as people think. And there's nothing like knowing that you can have that root canal to actually go in and save that natural tooth, because we know that they play an overall picture in our health and well-being.
Yes, they do. As I said, central function for your teeth is chewing, and that's how you maintain your nutrition and your energy level.
Which is crucial.
Which is critical to your health.
Of course. Now, how does treating that tooth infection actually help impact what's going on inside? Because all we know is it's a sharp shooting pain, sometimes unbearable. We just want it fixed immediately, but there's long-term effects as well.
Right. Well, anytime you can remove a source of inflammation or infection in your body, it improves your overall health because it doesn't tax your immune system. So if we can address those early on and remove them, then your immune system is able to take care of other issues in your body.
So preventing problems down the road. Now, we decided that that's all you do is root canals. A lot of people have a lot of thoughts about what's going on when we get one. What are some common myths that you hear all the time?
Well, I think the one that we want to get rid of is that it's a painful procedure. And it's not. The actual procedure itself should not be painful whatsoever. In fact, I have patients fall asleep in the middle of treatment on me. But I think the association with pain is the pain that brought someone to see us is what people think of as a root canal. But when we determine that a root canal will relieve that pain, we can make you pretty comfortable and get you through the procedure with minimum drama and make it as easy as possible on you.
That is very true. Do you think there's any myths surrounding if these root canals and the crowns that are placed over need to be replaced over time?
Well, yes, crowns can need to be replaced if any decay develops along the edges. That's why it's really important for you to keep up with exams and cleanings with your general dentist at least twice a year, so that we can identify those problems early on and address them before they become a big issue.
Of course, advocating for your own health is always the best route to take. We appreciate your time today, Doctor.
Oh, you're very welcome.